who is the CSO representative. She's in the meeting room and would like to make an intervention. And then after that, over to Seth Berkeley. Please, Fifa.
Thank you, Jon-Arne. Good day, everyone. And it's great to be with you today in person with WHO colleagues. CSOs strongly support the ACT-Accelerator and agree with the statements of others on the need to focus on closing the gap on access to COVID-19 tools in the Global South, including on increasing vaccine uptake, ensuring access to affordable novel antivirals, and to address the drastic reduction in testing. We are also increasingly aware of the need for pragmatism and the need to listen to countries about competing priorities such as China. A statement earlier that we need to push.
You were just muted.
Sorry, I'm muted.
मैंने अपना unmute किया है क्योंकि ये mute.
I think it was done by the technicians. They muted the wrong speaker.
Can everyone hear me?
Can you give the floor back to the meeting room?
Okay, great. I'm not sure where I stopped, but
now we can hear you.
Great. So just to reiterate that we agree with Ted Schreiber's statement earlier on the need to integrate COVID-19 tools together with other disease areas because we recognize the need for pragmatism. We see a role for the ACT-Accelerator here, but the ACT-Accelerator needs to be well funded to take this agenda forward. We hope that donors can consider this in their budget planning and pledges. We also think it's incredibly important that we start having conversations about the future of the ACT-Accelerator. We support it continuing and evolving or undergoing a reinvention to ensure coordination and convening on this pandemic while looking and planning for the next pandemic. Part of this includes to ensure that the upcoming FIF or Intermediary Finance Fund reserve a percentage of funds for the maintenance of routine services during a pandemic and the rebuilding of health systems that have been decimated during this pandemic. There are also several reforms that CSOs consider non-negotiable for the next iteration of the ACT-Accelerator. And that includes real co-creation of interventions with global health agencies, equal intellectual partnerships with LMICs, and that we start thinking about a new TRIPS order. We recognize that there's a difficult financial environment, and we look forward to working with all of you towards finding a balance that achieves equity. Thank you.
Thank you, FIFA, and thanks for participating in person today at the WHO headquarters and for your voice both in the Facilitation Council and your CSO community's voices across all the pillars.